field of healthcare is a huge field. There are so many kinds of doctors and specialists, it can at times be perplexing trying to figure out who best to see. In addition to the traditional doctors we're all familiar with, like orthopedic specialists, internists, ophthalmologists, and so on, there is another area known as alternative healthcare, and this includes chiropractors. And in this area, there is a group of specialists known as chiropractic neurologists. These are chiropractors who've had an additional 3 years of training in the neurological system, which makes a huge difference. Most people are not even aware of them, and little wonder. There are only about 700 of these board-certified doctors in the world. It is called Alternative Health Solutions.
Neurology is the study of the brain and the nervous system. And the brain and the nervous system control everything in the body. It controls every cell, every tissue, every muscle, every organ systems, emotions, hormones, everything you can possibly think of is controlled by your nervous system. A functional neurologist then is basically interested in how the nervous system, including the brain, is functioning. My medical counterparts are looking more for what are called ablative lesions, things like strokes, anything that will injure the brain or cause dysfunction because of actual structural damage. And once that's ruled out, then basically the patient is left with a certain degree of function, and that's where we come in. We come in and basically try to optimize the absolute best function of everybody's nervous system that we can.
It all happened when my son was about 3 years old. All of a sudden, he fell apart. He was quiet, calm, and then at 3 years old, he just fell apart. Didn't know what was going on. Went to the doctors. They all said, oh, you have a new baby at home. He just started school. He's went from half days to full days, started carpooling. They just had a million excuses, said it was all normal, and I just knew it wasn't. I knew there were just so many other little avenues to take to help him that no other doctors would help me with. And it was a rough ride. His heart rate was all over the place, but I stuck with it, kept giving him the vitamins and things that they recommended here, and then after a few weeks his heart rate went back to normal. He was just this calm, funny, happy kid again.
Our treatments focus on things that are non-invasive, very simple, practical things that we can use to drive the nervous system to make a definitive change. Because the alignment of the back and the muscles in the back and everything that has to do with the spine is all controlled by the brain, we do more of a brain functional analysis along with a biomechanical analysis so we can ascertain the function. So if somebody came in, for example, with headaches, instead of just doing an adjustment for their neck like a general chiropractor would do, we are going to be very specific about if we adjust the neck, where we adjust the neck, how often we adjust the neck, if we use adjustments at all for that particular person.
In my case, I always have a lot of eye strain, which is all associated to the weak part of my body, which is my left part of my body. And I'm a very right-brained, out-of-the-box person anyway, so that makes sense.
Do you really love what you do?
I love what I do. I'm so passionate about what we do. I feel incredibly blessed to do something that is helpful to patients and to people in general, but also that I will never get bored of it because there is always more to learn. Always more to learn. Always more on the horizon and always more that we could be doing even better, and that really drives me.
My original problem was I had low back pain, chronic low back pain like the average 40-year-old. What kept me here is the care I was getting from Dr. Engelbart. They look at the brain and the brain functions and treat the neurology of the brain rather than your spine and crack your spine. What brought me here was originally the hydrobed and a chiropractor. What kept me here is the neurological treatment that I uniquely need now because I had a stroke last summer. I'm getting the kind of treatment here that every stroke victim should get.
Every chiropractor should have this type of training, but it takes a long time and it takes a lot of dedication and a lot of passion to want to pursue this because, you know, outside of your doctorate, then we continue schooling and we continue testing and we are always constantly having to stay up to date on the newest and the latest and keeping our sharp edge so that we know what's going on in research and being involved in research ourselves.
At the beginning, I had a lower back issue and I couldn't. Sometimes I would bend over to do something and I would throw my back out. So it was a reoccurring thing that happened year after year, and finally the last time it happened, I said, okay, I need to get some real help to fix the problem. So the first time I walked into Dr. Engelbart's office, I could not even stand up straight. That's how bad my back was. After a few treatments, I was able to stand up, but I've been going to Dr. Engelbart for 10 years now, and I've not had one incident with my lower back occur again. So that's my story. That's how good and wonderful work she's done for me.
Dr. Natalie Engelbart specializes in treating mood disorders such as depression and anxiety, insomnia, movement disorders, muscle tics and tremors, balance and coordination problems, vertigo, migraines, learning disorders, chronic pain disorders, sports performance, brain optimization for enhanced memory, cognition and stress adaptation, as well as for prevention of dementia and other neurodegenerative diseases.
We are very different in a very good way. We really are, every single person that you meet in here will be extremely passionate about your care and about what we can do to help you. And it's not about the numbers of the people that we see, it's about the quality of care that we give. And if we have to step outside the box to do that, so be it. Now, stepping outside the box will never mean that we compromise on our ethics or our integrity or try something that is not proven or scientific. We are very, very, very picky about the types of therapies and procedures that we do. And you can always rest assured that whether it's a supplement that we're recommending or a treatment that we're giving you, that it's tested, it's tried, it's true. It might be new and it might be cutting edge, but it'll work.
My son, less than a year ago, we found out that he had a problem with his speech. He just wasn't putting his words together like we felt he should be by his age. He had just turned 4 at the time, and we found out through a couple of different tests that he did have a language delay, not necessarily speech, but language. And it was not only receptive in terms of speaking, but also receptive in terms of understanding what people are saying to him. Immediately we noticed that his speech was improving. He was understanding a lot more of, he can understand you, but a lot of times it was questions, if you ask him a question. And then the huge change has just been his demeanor, his behavior, he's just so much more sweet and loving, and I can redirect him so quickly. He's like a different kid.
And what would you like people to know about this medical practice that they really probably aren't aware of?
Chiropractic was actually founded on the premise and on the fact that the nervous system controls every function in the body. In this day and age, I would actually more accurately term it as complementary medicine. It's alternative in that we do not use drugs or surgery or anything invasive. Our treatments focus on things that are non-invasive, very simple, practical things that we can use to drive the nervous system to make a definitive change.
A look into the unique field of chiropractic neurology as practiced by the doctors here at Alternative Health Solutions. I'm Doug Llewelyn reporting from Flower Mound, Texas.
That concludes this edition of Close Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.